Common medications that sabotage weight loss. Today we're going to talk through some of the most common over-the-counter drug types that can sabotage your weight loss. This can be from cutting metabolism, cranking up hunger, or blurring your body's natural fullness signals. These aren't obscure medications, they're everyday things you take for allergies, sleep, pain, constipation, or even heartburn. And while they serve their purpose, they can quietly slow your progress. Make sure you watch each one to keep your weight loss on track. Some of these were really surprising. Let's get started. First, antihistamines and related sleep aids. Did you know that some of the most common ones could be affecting your weight? Antihistamines come in two main flavors. First generation versions like Benadryl, Tylenol PM, ZzzQuil, or Unisom are sedating. That means they can cross into the brain, make you feel drowsy, and are often used as sleep aids. These are the worst offenders for weight. They can increase appetite, blunt your fullness signal, and reduce daily movement. Second generation antihistamines like Claritin, Zyrtec, and Allegra are marketed as non-drowsy. They don't knock you out, but studies still link long-term use to higher BMI and waist size. The effects are milder than the first generation, but still real. Here's what you can do if you take these. For allergies, stick with the lowest effective dose. Consider Claritin or Allegra if you're prone to weight struggles, and try using drug-free rinses like saline or HEPA filters. For sleep, look at your habits first. Don't lean on sedating antihistamines unless a doctor says you should. We covered getting good sleep in this other video, link up top. And there's a lot of other good information in there about how good sleep can help with weight loss too. Second, chronic use of NSAIDs, non-steroidal anti-inflammatory drugs. If frequent pains have become a part of your life, chances are you're taking regular painkillers to manage them. NSAIDs like ibuprofen and naproxen are okay for short-term use, but chronic high-dose use is associated with fluid retention and lower insulin sensitivity. That means that even if you're losing fat, the scale may not show it, and over time, metabolism can shift toward fat storage. This is especially relevant if you have arthritis, migraines, or use these for daily pain meds. Now, in terms of what you can do if you do use these, don't stop taking them if your doctor prescribed them, but ask whether lower doses, cycling off, or non-drug pain therapies might be an option. Keep an eye on your diet quality and blood sugar if you're a long-term user. Speaking from personal experience, getting away from ultra-high processed foods can help. Within a couple of weeks of eating healthier, I had a lot less aches and pains and was able to stop taking ibuprofen myself. Third, acid reducers like PPIs and H2 blockers. Do you find yourself taking heartburn meds almost every day? These meds are among the most heavily used over-the-counter drugs. Proton pump inhibitors like Prilosec, Nexium, and Prevacid are especially tied to weight gain. They can increase ghrelin, the hunger hormone, lower GLP-1, which helps you feel full, and disrupt your gut ecosystem, all of which tilt your body toward weight gain. It's possible that long-term heavy use can contribute as much as 5% of your body weight. If you use PPIs daily, talk to your doctor about stepping down to H2 blockers like Pepcid when possible. One of the best ways to get off these meds is to find out what's causing the heartburn in the first place and address that. Dietary changes may help lower dependence on these meds, but you can also reduce late-night eating, alcohol, and large meals to help further. Number 4, corticosteroid nasal sprays. When your nose is stuffed up, it's hard to focus on much else. Nasal sprays like Flonase, Nasacort, or Rhinocort are considered low risk, and at standard doses, they mostly stay in your nose. But with long-term, high-dose or combined steroid use, it can start affecting more than just that nose. That means you might feel hungrier, have more fluid retention, and more belly fat. For seasonal users, it's not really a concern, but if you're using sprays with inhalers or oral steroids, the weight effects can add up. If you take these, remember that more isn't always better. Stick to the lowest dose that works for you and avoid doubling up on steroid products unless prescribed. If you need long-term therapy, talk to your doctor about whether lower doses or alternatives are possible. Fifth, melatonin. So you've turned to melatonin to get a good night's sleep? You're not alone. Melatonin isn't directly fattening, but timing and dosage matter. Used correctly, it can support your body's natural day-night cycle and your sleep, which actually helps weight management. But if you take too much or at the wrong time, it can actually make you feel hungrier later at night and mess with your body's natural signals for when to eat. Inconsistent or excessive dosing is where weight issues can start to show up. If you're using melatonin, try to keep doses low, less than 3 milligrams. and take them about 60 minutes before bed. You could also consider taking tryptophan instead to support your body's own system for producing melatonin. Also, make sure to have adequate time to sleep, at least 7 hours. Protect your body's rhythms with consistent sleep-wake times and morning light exposure. That's more powerful than any pill. Still watching? Good. Go ahead and click that subscribe button now too. Okay, number 6, decongestants. Ever take a cold and flu pill to get through the day, only to toss and turn at night? Decongestants are the go-to for stuffy noses, found in Sudafed, Dayquil, and a ton of other cold and flu combos. They don't usually cause weight gain directly, but here's the catch. They're stimulants. They can raise blood pressure, make you feel restless, and worst of all, wreck your sleep. And poor sleep is one of the fastest ways to push hunger hormones out of balance. Over time, that means more belly fat, even if your diet doesn't change. If you need a decongestant for more than a day or two, try to use it earlier in the day and avoid bedtime use as much as possible. For bedtime relief, lean on non-drug fixes like saline rinses or nasal strips. I actually use nasal strips myself, and they work quite well. Save the stimulants for when you actually need to breathe through meetings, not when you're supposed to be asleep. And finally, laxative and fiber supplements. Constipation is a frustrating problem, and it's easy to reach for a quick fix. Laxatives and fiber can certainly help, but they might not be the whole answer. Laxatives like Bisacodil and Senna, and fiber supplements like Metamucil or Citracel are widely used for constipation. They're not directly fattening either, but here's the subtle issue. Long-term overuse can alter gut health and bacteria, both of which play a role in weight regulation. Some stimulant laxatives can also cause rebound constipation if used daily, leading you to eat irregularly, snack more, or lean on ultra-processed, easy foods. It's easy to feel like fiber powder can cancel out a bad diet, but the opposite is true, meaning that if you lean on supplements while still eating poorly, you may end up doing more harm than good. Here, use fiber supplements as a backup, not a crutch. Get fiber from real foods first: fruits, vegetables, beans, and whole grains. And if constipation is frequent, talk with your doctor about longer-term solutions. Think of fiber supplements as a helpful occasional tool, not as an everyday solution. I've noticed that for me, drinking more water every day was a big help. And here's a meme we think you'll enjoy. Have an idea for a future meme? We'd love to hear from you in the comments. If we use your idea, we'll give you a shout out in the description. Most of us overlook how everyday drugs can influence our weight. While all of these drugs can have an impact on your weight, the good news is that each has a workaround. The first step is to empower yourself with knowledge and simple lifestyle changes. Working on improving your sleep, adjusting your diet, and staying hydrated. Next, remember that less is often more when it comes to medications. Stick to the lowest effective dose, adjust the timing of your dose, and consider drug-free alternatives like nasal strips or diet changes. And finally, if you're taking any of these medications long-term, always talk to your doctor or pharmacist about how you may be able to adjust them to support your goals. And now that you know what to look for and what can be done about it, you can help shift things in your favor for better weight loss. Now, if you like this video, you may be interested in this other one on what you can do about ghrelin, the hunger hormone, to help optimize your body's balance and make weight loss easier. Have a topic you'd like covered? Let us know in the comments. Thanks, and we'll see you next time.